This is the Good Neighbor Podcast, the place where local businesses and neighbors come together. Here's your host, Regina League.
Well, hello, everybody, and welcome to another broadcast of the Good Neighbor Podcast here in South Charlotte. One of my favorite things to do is talk to business owners, and I'm super excited today to meet and just talk to Dr. Kashiti Long. Good morning, Dr. Long. How are you?
Good morning. I'm doing well. How are you?
Great. I have really enjoyed reading up about you and your journey. I know you have a new practice here in Charlotte, and it's called Long Health and Wellness. And let's start by you telling us a little bit about yourself and your journey to medicine.
So my journey to medicine started when I was 4. I saw something on television that interested me, and I asked my mom what they were doing, and she's like, oh, they're doctors, they're saving that person's life. And from then on, it was like, well, I'm going to be a doctor. And so that has been what I've always wanted to do. I went to Morehouse School of Medicine in Atlanta and did my residency at Emory in Atlanta. And then I worked at a community health center in Greenville, South Carolina, for a few years before coming to Charlotte and working for one of the big hospital systems here. And after that, I decided that I could do more if I branched out on my own. And so I decided to open Long Health and Wellness.
Well, you are board certified in internal medicine and lifestyle medicine. I understand what internal medicine is, but tell us what lifestyle medicine means.
So in medical school, they always tell us to start with lifestyle changes for almost every condition and then add on medications. But the emphasis on the lifestyle changes isn't really there. Like at my school, we got, I think, about 6 weeks of nutrition, but it was only like 2 hours a week. And so that was more than some schools, but still not really enough to really help you dive deep with people. And so I decided to take some extra training after I finished residency. And the American College of Lifestyle Medicine had what I was looking for. So it's more focused on nutrition, physical activity, stress management, sleep, social connections, things like that, and the emphasis on how those can impact your health.
So in reading a little bit about your practice, it's really about being proactive. I think many of us only go to the doctor when something's wrong. Mm-hmm. So kind of describe your mission and what you strive to do with your practice.
So my mission is to help people be their healthiest selves through the prevention, treatment, and reversal of conditions. So if you are in that stage where you're like, I'm healthy, I want to stay healthy. Okay, let's see what we can work on to optimize that. If you already have something going on and you want to improve it or at least get it under control, then we can go in that direction. It's very patient-centered, so it depends on what your goals are. I can meet you where you are and get you and help you get to where you want to be. And that's the focus of the practice.
What are some of the most common issues, medical things you see happening these days with men and women that you treat?
Definitely high blood pressure is probably the most common thing that people have. And then we have sleep problems, acid reflux, headaches, diabetes, menopause, things like that.
So you can treat all of that. So if someone were to reach out to you, walk me through the steps you take in meeting with a new client, because it's very clear your journey from working in corporate healthcare to private practice is amazing. The amount of time you spend with a patient and how deep you go. So describe that.
So people reach out via my website. You can either enroll directly, so put in your information and schedule an appointment, or you can schedule a meet and greet, which is a phone call where we can talk about like if you're a good fit for the practice and how the practice works. And so both of those buttons are directly on the website. So if you schedule a meet and greet, I'll give you a call. We have a 10 to 15 minute conversation and you can decide if you want to proceed. And then from there you enroll. Also, you just hit the enrollment button on the website, you put your information in. After that, a button pops up that says schedule an appointment. Your first appointment is slotted for 60 minutes. So you have a full hour to talk to me, for us to get into your history, what your goals are, what you want to get out of being a member of the practice. And then we go from there. Follow-up appointments are scheduled for 30 minutes, but they can be longer or shorter depending on what's going on. And we just work towards getting you to your healthiest self.
Right. And I assume there's blood work in the beginning, those kind of preliminary things.
Yes. So most people, if you haven't been to the doctor in a while and you need blood work, I'll go ahead and order it for you. Our blood work, if you do the cash pricing, is like 90% off through our vendor. If you want to use your insurance, you can use your insurance and it can be whatever they usually charge the insurance. Some people who have like recently been to the doctor will show me their labs on their patient portal from whatever other system they were in, and I can review those and like, don't draw unnecessary labs on people. So if you just had labs 2 weeks ago, I'm not going to make you re-get your labs drawn. Most people don't like being poked with needles. So we do it depending on what's going on and where you are in your journey.
So share a little bit about your pricing model, insurance. You said about member. So explain that a little bit.
So Long Health and Wellness is a membership-based practice, meaning we do not charge your insurance. So it doesn't matter who your insurance carrier is. We accept all patients. The monthly membership fee that is listed on the website is what you will pay to be seen here. And to keep the practice small enough so that you can always get those 30 to 60-minute appointments, so that you can always reach me and be able to get an appointment same day or next day, the cash model is more efficient and just works better all around. And oftentimes we'll save people money in terms of you don't need to go to the emergency room or urgent care as often. You can possibly choose a higher deductible insurance plan because you don't need to go to a bunch of different specialists, because I can take care of most of your healthcare needs here. And so, in a roundabout way, it can save people money. Some people also use their HSA to pay for the membership. So it just depends on the person. But, for less than the cost of what most people would pay to cut and color their hair or to get a nice set of braids, you can have the monthly membership.
Oh, that's interesting. So I want to be clear. I understand as a potential patient, right now, let's say I go to an internist and various doctors that specialize. And I guess that's the way corporate medicine is these days. They don't really overlap, but coming to see you, are we able to see you for various things?
Yeah. So think of it like this. So I'm an internist. So I trained in I have some level of training in most of the specialties that come under internal medicine. Like every cardiologist, every endocrinologist, every pulmonologist was an internist first. And then they did subspecialties training to get to their specialty. So as an internist, you have a broad training in those things. But in corporate medicine, a lot of the times, because you're booked every 15 to 20 minutes, it's easier to just refer instead of delving into the weeds and trying to treat every single problem. Sometimes you just have to refer. But since I have more time, I can take it further in terms of trying to help you with your problem before referring you. Now, if we can't get it under control for some reason, or you're super duper complex, yes, then you probably still do need to see a specialist if you have some rare condition or something like that. But I can treat asthma, I can treat diabetes, I can treat heart failure, I can treat high blood pressure. Like if you're going to a cardiologist just for high blood pressure, it's probably because your primary care just doesn't have the time to really work you up and get into why your blood pressure is so high.
Is our diet probably the biggest concern when you sit down with people? Is it
For most people, I would say yes. At least 75, 80% of people, diet is something we need to work on.
Yeah. I noticed on your website, you offer a free guide that people can sign up for, 5 dietary changes to improve your health today. I love that. I'm going to do that.
Well, thank you. I do feel like there's so much misinformation and so many signals and like advertisements and what's healthy, what's not healthy, that, dialing in on diet can benefit a lot of people. For example, like the other day, I saw someone who said that they eat salad all the time and this, that, and the other. So then you think, oh, they're eating salad. That's great. So then I asked for what's on the salad, and it's like lettuce, meat, cheese, and some creamy dressing. So it's not really, when I think of a salad, I think of like a leafy green base, a bunch of other vegetables, and maybe a vinaigrette and some type of protein, not just lettuce. Like if lettuce is the only vegetable on your salad, it's probably not all that nutritious, So
Yeah.
You have to like ask the deeper questions.
Yeah, I was thinking about all the, marketing diet trends. It used to be low fat, then low carb, and, it's gone full circle. So I think we all do have to pay more attention to that. Well, this is so exciting, and congratulations on being able to open your own practice. I know it's going to be amazing for you. So when you're not running this beautiful new office, what do you like to do for fun?
For fun, I like to garden. I have a little vegetable garden that I'm going to be trying to bring back to life in the coming months leading up to spring. I also like to read. I am in a book club that meets every other month. I like hiking, being in nature. I have a little Shih Tzu that I love to play with and cuddle up on the couch with, and just spending time with friends and family.
That's wonderful. It looks like you moved back to Charlotte to be closer to family when you got out of school and started the practice.
So I actually grew up in Florida. And then when I was in school, my mom and my youngest two siblings moved here. And so after college, I was here for a little while. And then I went to med school in Atlanta and then kind of bounced around a little bit. And then, yes, I did wind up back here.
Well, Charlotte's an amazing place. So tell our listeners how to find you.
So I can be reached at 980-272-0061 if you have any questions about the practice. If you want to review the website, it is longhealthwellness.com. And if you are interested in signing up, you can hit the enroll button at the top of the website.
And you can sign up for that free guide on the dietary changes to improve your health. That's really cool, great idea. Well, thank you, Dr. Long. It was really great getting to know you today.
Thank you for having me.
Thank you for listening to the Good Neighbor Podcast. To nominate your favorite local businesses to be featured on the show, go to gnpsouthcharlotte.com. That's gnpsouthcharlotte.com or call 980-351-5719.